Hello everyone, now let us discuss about muscles of the head that move the tongue and assist in mastication and speech. The tongue is a highly mobile structure that is vital to digestive functions such as mastication, detection of taste, deglutition, and it is important in speech also. The tongue's mobility is greatly aided by its attachment to the mandible, styloid process of the temporal bone and hyoid bone. The tongue is divided into lateral halves by a median fibrous septum, and the septum extends throughout the length of the tongue. Inferiorly, this septum attaches to the hyoid bone. Now, muscles of the tongue are of two principal types, extrinsic and intrinsic. The extrinsic tongue muscles originate outside. Extrinsic means originate outside the tongue and insert into it. They move the entire tongue in various directions such as anteriorly, posteriorly and laterally. Whereas the intrinsic tongue muscles, they originate and insert within the tongue, hence the term intrinsic. And these muscles, they alter the shape of the tongue rather than moving the entire tongue. So the muscles that are helpful in movement of the tongue are extrinsic tongue muscles. And the extrinsic and intrinsic muscles of the tongue insert into both lateral halves of the tongue. An important point is the names of the extrinsic tongue muscles, they end in glosses. Ending will be glosses, meaning tongue. For example, the genioglossus. Here the origin is mandible, pulls the tongue downwards and forward. Whereas styloglossus pulls the tongue upward and backward. And hyoglossus, it pulls the tongue downward and flattens it. And the palatoglossus rises the back portion of the tongue. And the first name also indicates their origin. For example, genioglossus indicates the mandible, whereas styloglossus, the point of origin is styloid process, and in hyoglossus, the origin point is hyoid bone, and in palatoglossus, the origin is soft palate. Here you can see the various extrinsic and intrinsic muscles of the tongue. If you see here, this part is the genioglossus. And here is the hypoglossus, this one and this one, hypoglossus. And one more muscle is, these parts are this is the palatoglossus, this one, and this muscle is the styloglossus. Now let us discuss in detail. The first muscle is genioglossus. Genio means chin, glossus means tongue. Origin point is at the mandible and inserts. It inserts under surface of the tongue and hyoid bone. And coming to the actions of genioglossus, it depresses the tongue and thrushes it anteriorly. That is, it aids in protraction. Innervation is done by hypoglossal nerve. Hypoglossal nerve, which is the 12th nerve. Next is styloglossus. Stylo means stake or pole-like styloid process of the temporal bone. Glossus means tongue. Origin occurs at styloid process of the temporal bone. Coming to the insertion, it aids in the side. It gets inserted on the side and under surface of the tongue. Coming to the actions, it elevates the tongue. Styloglossus elevates the tongue, whereas genioglossus depresses the tongue. Styloglossus elevates the tongue and draws its posterior. And it is also innervated by hypoglossal nerve. The next is hypoglossus. Point of origin is greater horn and body of the hyoid bone. Gets inserted at the side of the tongue, and action is it depresses the trunk and draws its sides. So hypoglossus and genioglossus both depress the trunk, and it is also innervated by hypoglossal nerve. The next is palatoglossus. Palato is nothing but roof of the mouth or palate, soft palate. Origin, it occurs at the anterior surface of the soft palate and insertion occurs at side of the tongue. Coming to the action, it elevates posterior portion of the tongue and draws soft palate down on the tongue. Coming to the innervation, it is innervated by pharyngeal plexus, which contains axons from the vagus nerve. Palatoglossus is innervated by vagus nerve. Now let us discuss the significance of these muscles during the intubation during anesthesia. When the general anesthesia is administered during surgery, a total relaxation of the muscles results. And once various types of drugs for anesthesia have been given, especially the paralytic agents, the patient's airway must be protected and the lungs must be ventilated because the muscles involved in respiration are among those paralyzed. Paralysis of the genioglossus muscle causes the tongue to fall posteriorly, which may obstruct the airway to the lungs. And to avoid this, the mandible is either manually thrust forward and held in place, known as the sniffing position, or a tube is inserted from the lips through the laryngopharynx, that is the inferior portion of the throat, into trachea, which is nothing but endotracheal intubation. People can also be intubated nasally through the nose. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.